Louisiana Republican Senator Bill Cassidy is gearing up for round 2 to revamp health care. He's tried once before, in a bill he wrote last year with Senator Lindsey Graham to repeal and replace Obamacare. Now, his priority is to make health care and drug prices visible to patients.
What if pharmacies had to put out publicly, this is what we charge for these drugs? It's been done before. When Medicare Part D came into place, Walmart and Walgreens put out something where they would only charge $4 for certain generics. And patients flocked to those two places to get their $4 generics, and everyone else followed suit.
It's an idea Cassidy, along with a bipartisan group of senators, first pitched in March. Now he's proposing it again, along with several other legislative fixes he says will bring down the cost of health care. Cassidy isn't revealing when he will introduce new price transparency legislation, but hinted it could drop in the coming weeks. He's also urging Congress to revive a bipartisan bill spearheaded by Senators Lamar Alexander and Patty Murray. The bill aims to stabilize insurance markets and give states more flexibility on health insurance requirements. It failed after Republicans added language to it that would restrict access to abortions. Some of Cassidy's proposals have earned bipartisan support, but he's also pitching some ideas that Democrats say are meant to sabotage the Obamacare exchanges, including giving states block grants and codifying President Donald Trump's executive order to allow short-term health plans that don't meet current Obamacare insurance requirements.
Even though I'm a mayor and governor and I like the states having control, on healthcare what you find is it's a race to the bottom. If you give us, the states the ability, some will try to spend less. On the theory that, well, maybe if we spend less, we can chase the sick people across the state lines and the next door.
Kane, a Democrat who has his own bill to create a public insurance option, says there are some aspects of Cassidy's proposals that he can get on board with, but he ultimately wants the Senate Health Committee to have a broader discussion about all the ideas and find a happy medium.
I'm not afraid of discussing any proposal, so I think the problem is we haven't been willing to have a meaningful discussion.
Cassidy says he knows his ideas might not be the best for everyone, but that he believes Congress needs to do something to help families struggling to afford health insurance.
In Louisiana, the 60-year-old fellow with a family is paying as much as $50,000 after-tax dollars a year on the individual market before his insurance fully kicks in. $50,000 after-tax dollars before his insurance kicks in. We've got to do something for that family. It may not be ideal, but he can't afford $50,000. So the alternative is to have nothing at all, or to have this.